There are people within the same week have to do a morning shift, have to do an afternoon shift, 2 days, and then 2 days of the night shift. I think these are probably some of the things which in the coming years probably will change as the society also starts looking into these things.
Well, thank you so much for bringing up corporate culture. This conversation with you as medical director, it's very comforting for me to understand that the medical director of Maarga is looking at it all in a holistic way and not from a psychiatric textbook. Good day. I'm very pleased and quite interested in the conversation I'll have today with Dr. Girish. He has almost 3 decades of experience in the field of mental health treatment and is a postgraduate of NIMHANS. Dr. Girishchandra has also worked overseas for 15 years as a consultant in Australia and with the NHS in the UK. He specializes in treating a wide range of mental health-related problems. He currently serves as medical director and senior consultant at Maarga Mindcare, Bangalore. Dr. Girish, you have extensive experience working both in India and overseas, including with the NHS in the UK and in Australia. How would you compare the practice of psychiatry in the UK or in Australia compared to the treatments in India?
I think it's very difficult to compare. The focus on primary care is very, very good in both Australia and in UK. So everything revolves around the primary care, and whatever inputs you need, whichever the types of problems, it goes through either your general practitioner or your family physician. So the GP will be aware of everything that's happening for that person. It's very rare to find a person who does not have a family physician or a general practitioner. So unfortunately, we don't have that type of system in India, because here, you want to see a particular doctor, you can go and approach, you can go and see any doctor you want. So for unless the patient or the client themselves keeps going back to the same doctor, for a doctor to be aware of that patient or that family is not possible in India. Whereas in UK and in Australia, that information is available with the general practitioner where they are associated with. And also there is the information about their health can be shifted from one doctor to other doctor much better in UK and in Australia. So you want to see a cardiologist or you want to see a psychiatrist, all you have to what you have to do is go and see your GP, and the GP refers you to that doctor, and that is the system what is there. Other big difference, especially in cities like Bangalore, is a lot of corporates, a lot of tech companies, and so there is a lot more penetration of insurance, health insurance companies, corporate health insurances, which is not the case in many of the other Indian cities as well. So that's one good thing what we see here. So in Australia or in UK, the private health care was not as much as what it is here in India. So that is, I think, those are the main differences what we see. And also, I think the access what you have for the specialist and super specialist is extremely good in some ways.
Your bio mentions you treat a wide range of conditions from anxiety to addiction. Are there any particular mental health issues that you notice are becoming more prevalent as far as public awareness, and anything, especially in a big city like Bangalore, are there certain things that maybe are more prevalent than in some other places?
Bangalore is growing, so people's expectations and people wanting to sort of seek help also is probably at a higher level than what it can be or what it is in other places. So, for example, if you just take the anxiety, if you take the corporate culture, like, the deadlines and how they have to finish and having to work with different time zones and these kind of things, have disrupted people's lifestyles and sleeping habits. And some of them are working for Australian time, some of them are working for US time, and sometimes they have to do both, and all these kind of things have affected. If they do it once in a while, it's okay, but if they have to do it repeatedly, it affects their overall health and definitely mental health. So the anxiety is definitely a problem, and increased depression type of symptoms.
Well, thank you so much for bringing up corporate culture. This conversation with you as medical director, it's very comforting for me to understand that the medical director of Maarga is looking at it all in a holistic way and not from a psychiatric textbook. Because this corporate culture, I hear from people that I know that are friends, people that I work with in other areas, unless professionals with some heft behind their title call this stuff out, people really begin to believe that that's appropriate and it's the right way to live, and that those pressures and those expectations are appropriate.
You're right on that. Like, for example, the shift work culture. I know the corporates have to work on shifts. They have to provide services at different time zones, and true. And also there are certain types of jobs which needs sort of 24-hour shifts and 3 shifts a day. But how well planned from the person's point of view, from the individual's point of view. Most of the times, those things are planned from the corporate point of view or the client's needs, not really focused on the individuals. There are people within the same week have to do a morning shift, have to do an afternoon shift, 2 days, and then 2 days of the night shift. I think these are probably some of the things which in the coming years probably will change as the society also starts looking into these things.
You use a combination of conventional medicines and various psychotherapy techniques. Can you walk us through your general approach when a new patient comes to you?
Okay, so when the new patient comes to us, we look at how the patient has arrived to us. Is it referred by a particular doctor or a particular person? And or they have walked in themselves. So that gives us an indication about sometimes what to focus on. So once they come to us, we keep a very open mind in assessing and understanding what they are going through. We just we do want to know about what is the symptoms they are going through, but also we want to understand the circumstances, the background they come from, and so what kind of difficulties they are facing. Is it financial? Is it family? Is it work? And so we go through an elaborate assessment structure, which we follow. And once we sort of go through that and we understand their problem, we come to some kind of a meaningful working diagnosis. Then we start looking at a comprehensive treatment plan, but not just medicines. And then we start looking at the actual treatment plan, where whether the person needs medication, whether the person needs just therapy, or they need a combination of medication and therapy. So before therapy, if they need any kind of psychological assessments, we look into that as well. So all these things we take into account. So from it's not just, okay, you come with a problem with sleep, doesn't mean that you take a sleeping pill and go. So not that. And why the problem with the sleep, and what's causing it, what's the background, what's the lifestyle. All these things we look at and try and put in a plan for these aspects. For example, it might be there are certain procedures which which is available for within the mental health service providers. For example, if somebody is going through a very, very severe acute depression, maybe they need a treatment called ECT, or electroconvulsive therapy, which is in common language shock treatment. Right. Nowadays, there is another type of treatment available called transcranial magnetic stimulation, or TMS, we call. So repetitive we do, so we call it as a RTMS. So we do all these procedures as well: psychological treatments, medication management, And also we try and, as far as possible, of course we are a private sector, we can't completely dictate what's going to happen in their lives, but as far as possible, I don't just stop at giving the medications and advising these therapies and stop. If there is a need for me to touch base with the HR, I will do that. If there is a need for me to speak to the school teacher, we will try and do that, because it's not always possible to do everything. But we don't stop at like we will go to whatever extent, whatever practically meaningfully possible for us to do. We stretch ourselves and we try and do it as far as we can.
Well, what I heard you say initially is a lot of listening, because the initial question was, when they come in, how do you know? How do you know how to help? And what I heard you say is listening and looking at the whole picture, which takes time. So that means you're not rushing anybody, and you're not sitting there on a list and saying, this is your problem. And I love that you use the term working diagnosis, because that means that diagnosis may change. Could you elaborate on what you mean by your belief that your work is about helping people lead a quality of life? What does a quality life look like?
What we are talking about, quality of life, is quality of life without mental health problems, if I can say that. It's not just about the diagnosis or the mental health problem, what they are going through. Like, we look at an individual and their different types of functions, whether as an individual, what functions they have, their biological functions, and their social functions, and their way of coping at workplace. And every one of those things we have to look at if they really need to have a good quality of life. So we try and address every one of those aspects, and that is what we try to do with every person who walks through the doors at Maarga.
It struck me as you opened with your answer that that phrase, I hadn't thought of it so clearly. Free from mental health problems doesn't mean the mental condition goes away, but it means the navigating it goes to the background and social interaction improves.
So we want people to get to that stage where the problems come, problems go, but you don't stop living. You need to do what you have to do. You need to enjoy what you're doing. That's ultimately, that's what we would like to see in people who come to see us.
Coming to the end of our discussion, for someone who's struggling with their mental health but is hesitant to seek professional help, what would your single most important piece of advice be?
I think the single most important thing would be, don't wait till it becomes really bad. So the sooner you seek help, the better. Because the thing with mental health problems is that as it gets worse, your overall ability also starts shrinking. So your ability to help yourself, your ability to seek help, all these things also starts getting affected. Or come to Maarga, come to us and talk to us, and we will be there to help you. So the single most advice would be, don't wait till it becomes bad. So sort of come to us. The sooner you come, the better. It's okay not to be okay. So that's what I would say.
That's right.
So be kind to yourself. We are there to support you. So the sooner you seek help, the better. And wherever it is, it is with your family, going and talking to them, whether it is with seeking support from friends, or coming and seeing your doctor, seeing you if you have a GP with whom you feel comfortable, you've been seeing from a very long time, go and talk to them.
So I'm going to add on two little unexpected questions there. One would be, what is the single best thing a loved one that sees you having a problem could do? Say something or not say something. And I also want to touch on, come see us at Maarga. Can someone walk in?
That is the second part, yeah. If somebody wants to come and see us in Maarga, they can walk in any time of the day. It's a center 24 hours available. So may not be sometimes the clinician not there available for you or then and there, but we will organize, we'll work out something. We'll give you some kind of support and something we'll be able to do. Okay? That is for coming into Maarga. regarding the loved ones, and so if they see someone struggling, and so you without speaking to the person, you tend to assume, sort of, if you approach them and tell them, like, are you okay, then what will they think, and will it affect their confidence, their self-esteem? All these kind of things will be running through the
helper's mind. Yeah.
So, but the longer you wait, the problem is only going to get worse. So I think if you see the person struggling, if you see them not coping with family-related responsibilities or work-related responsibilities or academic-related issues, don't wait for too long. It's okay. And sometimes I see people coming to us to talk about their loved ones, and they come, say, I'm seeing this is what is happening. And sometimes they discuss, and then they go back with a plan, what they need to do, how they can handle. So that's another way of understanding and
So
addressing.
they get some advice, and that the family, again, holistic care, the family also receives support. So it sounds like I got the same answer to both questions. If it's me, be kind to myself and don't wait. If it's my loved one, be kind, find a kind way to bring it up, don't wait.
Absolutely.
So, okay, well, that's simple. It's a simple answer to what I thought might have been a complicated question. Okay, that's our episode. Thanks for watching, and I really hope you'll join us again as we continue these conversations. I think there's good and healing to be found for all of us in this topic, and we'd like to see you back for the next one. Ellen Chamberlain, thank you.